Hello friends, welcome to a new question. 62-year-old coal miner with 10-year history of progressive dyspnea develops pulmonary edema, pleural effusion and hepatic cardiac cirrhosis. Pulmonary testing shows decreased FEV and decreased FVC. Lung biopsy is shown here. Decreased FEV and decreased FVC is restrictive lung disease, and here this is showing the coal a carbon pigment accumulation is shown here, which is carbon macules are shown actually. What is the cardiac transplantation? This is cardiac complication. This is restrictive lung disease which can lead to cor pulmonale and finally leading to right heart failure. Describe the pathogenesis of liver disease. So there is first restrictive lung disease, which is this coal workers pneumoconiosis is a restrictive lung disease which causes cor pulmonale, which leads to right heart failure, which causes hepatomegaly due to backflow of the lung from the heart to the livers. So thank you for watching.